People hate to go to hospital. Today what we created is the patient stay in one place, the machines move around him. Most challenging thing to start a health city to get the best doctors. We do close to 40 cases a day, which is one of the highest in the world. Every investor wanted to start hospital chain. One of the most important thing everyone should understand is healthcare is a very, very core specialization which works on its core purpose is to treat patients. Healthcare should be affordable for the people.
In over past 3 decades, India has become a superpower of IT. And the epicenter of this IT revolution has been Bengaluru. Now, who would have thought in a city like Bengaluru and behind the IT doors, there would be a medical city coming up? Yes, I'm talking about Narayana Health City that has helped the people of Karnataka live a better life. And behind that, a lot of thinking and a lot of hard work has gone into, which has not only impacted the lives of people of Karnataka, but the world across. And today, I have someone who is the architect of that big project sitting with me, Mr. Sunil Narayana. Hello, sir. Welcome to the Healthcare Off the Clock.
Thank you very much.
Sir, I've observed rather, the experience of visiting a hospital has transformed, a lot in past 2 to 3 decades. Yes. A common man doesn't know what really goes behind the scenes. How does it happen? So can you break down the hospital workflows that you deemed perfect to provide that excellent patient care at Narayana Health?
Yes. Never been hospital visits a pleasant exercise for anybody as such. People hate to go to hospital. Until unless they're compelled, they will never want to go to hospital anytime. All in the past, hospital been a place to get treated and become normal and come out of that place. People never used to think too much about the conveniences and inconveniences used to happen during that process. But as the quality of life improved, as the affluence of the people improved, as the literacy of the people improved, as they kept visiting other countries and then seeing the healthcare in other places, the expectation of the people has increased. They wanted to have a lot of fringes along with the curative process what is happening in the hospital. So along with the curative process, that is a treatment, diagnosis and treatment, we need to see that whether it is planned in such a way that patient is put to the comfort so that his healing process is much faster and much better. So what are the major factors involved in the patient and the hospital interaction? So the first thing is that how do you make your service accessible and available for anybody who is in requirement. Today, the technology has made that access to the healthcare much, much easier because you don't have to go to a hospital to know that where there is a doctor available there or whether there is a test available to be done there or I have a slot to meet that doctor. So he can sit at home in his comfort, find out which all the hospital has got which all facilities, and then find out which slots is convenient for him, even which is affordable for him, and compare these hospitals and facilities around, then decide which one he should select. So it's an informed choice today rather than a compulsion to go to the nearest hospital. So NH has been very, very keen on ensuring that the people has got the best access and well connected to take the services to the hospital. So today hospital has created a front end of accessing the healthcare and a facility to handle them when they come to the hospital. So they are kept on hold across multiple levels of services to ensure that they don't have the unpredictability and difficulty in passing through this difficult journey of treatment. So the hospitals today has got very good infrastructure, designed in such a way that it has got the separation of OPD care, which involves the consultation and diagnosis, and the IPD care, which is specifically designed to make their stay comfortable and which is safe and which is protected from any kinds of infection. And there is an additional major critical area of emergency care, because most of the time disease never give a warning. A patient may need to end up to reach to the hospital any time in the day. So one of the most critical department is the emergency department, where any time it is well equipped with the equipment, with the doctors, with the nurses, with the administrators to ensure that patients are taken care any time when they are brought in without wasting any time. So the hospital is made in such a way that it is equipped to handle the OPD in an elective case, IPD if it is an elective case, an emergency to handle any kinds of emergency. And the environment has been improved over a period of time to ensure that this is more resembling to his own family or his own home or nearest to a hotel room where he is comfortably staying.
Absolutely. So in a way, it's like, making the person aware about it, then giving him access to the right care within the hospital. And towards the end, by providing him a kind of a very personalized, homely experience, improving the end patient experience. You have been with NH for almost 3 decades now.
Yes.
Yeah. And I think much before with Dr. Shetty as well. Yeah. What do you think NH has succeeded in doing better than other healthcare organizations in India?
Yeah. What is most important for a business is its purpose. Any business will grow to its highest level and sustain for long decades and centuries as long as it has got a purpose to deliver to its community. Dr. Shetty was very, very clear on what is that he wanted to deliver to the community of this country from the starting of his business in the hospital care. At the same time, he had always a thought to ensure that healthcare should be affordable for the people of that country, to ensure that nobody fall to poverty after this medical care. So the purpose is the one which made NH as separately stood across all these healthcare businesses today and allowed it to grow to the level it has reached today. In addition to that, NH continued its healthcare business as a single specialty. We were very good at doing cardiac surgery. Cardiac surgery was very expensive at that time. We knew we wanted to make it more affordable, to make sure that every patient who needed cardiac surgery can afford it without too much of pledging his family property or his gold or selling of his property. So we brought it down the cost of cardiac surgery to 55,000 rupees at that point of time, that is in 1997, when all other hospitals used to do cardiac surgery at 1,50,000 rupees. We were very successful in establishing assembly line production in cardiac care. When we started in Bengaluru, we were trying to get 4 cases a day. That was our target. In 4-year time, when we started NH, we were doing 12 cases a day. Today we do close to 40 cases a day, which is one of the highest in the world, which makes all spectrum of cases from simple cardiac cases to the most complex pediatric and adult cases. We created people to do the same surgery again and again, so they become extremely good at it. Their consumption of material become very, very less. Their results become so good so that overall stay in the hospital become better. The spending through complication become lesser and lesser, which gives the high viability for the cardiac surgery. So we become very well known in cardiac surgery primarily because our high capability in details. All the surgeries, what we do, we were very, very clear on how much money we spend on every patient, how we will reduce every penny what we spend on that patient, how much best quality of care we can give to that patient so that patient can be discharged from the hospital fast. So all these kind of innovations pushed us gave us a lot of, all these kind of innovations gave us the critical advantage on other hospitals to ensure that we can operate cardiac surgery at very affordable price.
So from our point of view, obviously we want to get the best care and the immediate care whenever we visit a hospital.
Yes.
How do hospitals, triage this whole process, making that whole experience very efficient and prioritize patients based on urgency?
Yeah, so this is specifically triaging happens in the emergency care. Emergency care has got a standardized model where the patient is evaluated immediately on arrival, or even today, patient's triaging happens from the time patient is picked up from the point where he was taken up.
So like an ambulance?
In an ambulance, yes. Ambulance is all equipped with all ICU kind of setup where it has got the all investigation equipments, therapy equipments, technical capability there, doctor support. So most of the triaging or stabilization happens in the ambulance itself today. Once the patient reaches to the hospital, patient is looked for his vital stability, whether the patient need an immediate attention, a threat to the life, or if the patient has got a time to go under a elective diagnostics treatment and then look for the admission under specific requirement. So the triaging is done on different color coding. So it looks at the prioritization is done on the color coding. So every person who is working in the critical care in ICU or in the casualty will know that this is the important patient to be taken up for immediate procedure or observation or take for an admission for the inpatient care. So the triaging is an important part of any of the casualty, which is well standardized today across all the hospitals in India.
Yeah. So if I have to simplify triaging for a regular audience, it's basically prioritizing patient's care, and there's a certain level to.
Exactly. How fast this patient need a medical intervention, how much we can wait, because casualty will get multiple patients coming at the same time. At the same time, we will not have enough resource to attend all of them at the same time. So the prioritization become very, very important in the casualty.
So you've had a really great journey with Dr. Shetty, and you've been with him since quite long. And now you have moved from one role to the other, and now as an administrator. So what has been your biggest challenge till date?
Yeah, the biggest challenge was to start the health city as such. Number one, we were successful in starting a cardiac center. We were very happy with the volume. We were very happy with the type of cases we are doing. But at the same time, we were finding extremely difficult to treat our patients with multispecialty problems. Because we were very much out of the city, we were not getting specialists to come and treat our patients. So, most challenging thing to start a health city, to get the best doctors. Doctors generally will like to work in the cities. They never come all the way to out of the city. Convincing them and selling them the dream that you are going to be the part of one of the biggest health mission of the country and you are going to be the part of the health city itself was our biggest challenge at that point of time. Yes, we were very, very fortunate to get a lot of good specialists to work with us. We were fortunate to see that a lot of patients had the trust to come to us when we started such a big health city project in that place and made it very successful.
I think there are very few medicities in India.
Yes.
And I think one of them is the NHCT that I know.
Yes.
and I've visited the campus multiple times, and I have seen a lot of hustle and bustle going, every moment. So sir, hats off to you for creating this landmark in the history of our country's healthcare. Surprisingly, the thing that you just told me around the vision of the creating a Medicity, and recently I was traveling from Delhi to Bengaluru, and one of my schoolmates happened to be there, and I told him about certain things about NH. He told me that NH is the first case study that they teach in Harvard Business School. Yes. So that is commendable. I think I wasn't aware about that.
Yes.
Yeah, and I can truly understand why do they teach it there.
Yes.
Yeah, there's a lot of learning that you can take from there.
Yes. I'm very proud to say NH is one of the business model which was discussed across the world in almost all teaching organizations, primarily because its genuine purpose. Dr. Shetty was very, very clear from this day one that if you don't have a solution which is affordable, that is not a solution at all. Today, mobile phones has become so popular and which is available for everybody, primarily because cell phone is available at very cheap price, network is available at an affordable price. So everyone is able to use it, everyone is able to get the benefit of it. In the same way, healthcare also needed to be affordable, then only it will become useful for the people. So that is the reason the NH has been a point of attraction for all business institutions to study. They were all thinking that for $1,500 you can do a cardiac surgery. That was the caption of that study, where they need $50,000 or $60,000 or $100,000 for doing a cardiac surgery in US. So they were not able to understand that how is it possible to create a model where you can do cardiac surgery for that kind of price.
So because you established so many facilities for NH, so what are your 3 key takeaways for anyone who's establishing a new hospital or any sort of healthcare facility?
Yes, very important question. Every doctor wants to start his own hospital. Today, every investor wanted to start hospital chain. One of the most important thing everyone should understand is healthcare is a very, very core specialization which works on its core purpose is to treat patients. Yeah. It is highly capital intensive. Everybody plan to start a very big hospital with a helipad on the top and which has got highest 5-star or 7-star of the facility with the top-notch equipments to bring in. You are willing to invest that kind of money, and then you with difficulty understand the most critical thing is to the care process. How your doctors are aligned with your patients to give them the comfort of healing without too much of pinching on their pocket. So anyone who wanted to start a hospital should always think the viability of that project. Which kind of community he is starting a hospital? Whether that community really needs such kind of a hospital. Secondly, you have that a business model which is affordable for the community which you are eyeing on. Are you willing to take up that kind of a lenient period to ensure that your care process is continued without deteriorating on your quality? So your working capital support is more important than your investment you are putting onto the first itself. Yeah. Many organizations, what you have seen is they build huge hospital with very high investment on equipments and the infrastructure, and then struggle to continue to go that care process, which is the most critical in that business. Struggle to bring in more good doctors, struggle to bring in patients with an affordable costing, and then fail into deliver what they are supposed to deliver. So the asset light model with a best clinical care team, a good protocol, will ensure that your project is viable for that community where you're eyeing on.
So there has been a lot of changes that you have brought into NH. So I just want to know one or two workflow changes that you think that has impacted both the NH and the customers, or I would say patients.
Yeah, workflows are very, very integral part of the hospital function. Every function works with strong support of the designing of the workflow. Workflow need to be patient-centric. Workflow need to be structured in a way that it is easy for both stakeholders, that means the patient and the staff. Traditionally, most of the customers in the hospital move around multiple counters. So today, a lot of thought processes are put into the system to ensure that they don't have to move from one counter to the other counter, rather than the service can move around with the patient. Very simple examples are how the health checkup has been getting designed. If you look at in an executive health checkup, when a patient comes to the hospital, they come and register, then they go to the lab sampling session, they go there and sit in a chair, somebody will draw their blood, and then they will be asked to go to the X-ray, and they will go to the X-ray. After that, they will be asked to go to the ultrasound, and then they will ask them to go to the echo room, and then they will go to some other test if they need to do it. So each time that patient will always carry one paper with him, and then every room when he has to change his dress and then put it into the gown so that they can continue their test. It's a lot of time waste and a lot of inconvenience for the patient. Today what we created is the patient stay in one place, the machines move around him, there is a person come take his blood on his table, on his bed, then the echo machines comes around him, take the echo is done, ultrasound machine comes around him, ultrasound is done, X-ray machine comes, X-ray machine is done. Only he has to just go out only for the consultation when he finishes all his investigation, gets report. So it's a revolutionary thought process Dr. Shetty brought in. Because nobody ever thought that you can create a workflow which the patient is the center, and your all other services move around him. We wanted to move this same kind of practices as much possible for all other care as well. Practically it may be a little difficult, but yes, there are multiple ways we look at things.
Yeah, it's very enlightening to know like how nowadays, that a personalization aspect of, I would say, consumer focus aspect has come into healthcare as well. A patient or the patient family, when they come to hospital, there's a lot of already, I would say, anxiousness or negativity. But then if they are put at the center and everything is at ease, that is happening for them, it's very supportive to them. So the next question I've asked to almost everyone, and I think you're one of the best person to answer that as well. How do you envision hospital 2050?
Yes, very interesting question. Answer can be very long and wide. Today, healthcare has evolved into a good infrastructure with doctors placed there, a good healing process. Technology has infiltrated into the healthcare today. What are the things which we'll be looking forward into 2050? It will be a contribution of technology and the thought process of the healthcare model. Why healthcare is very, very different from other things? No patient ever will be happy to spend money on healthcare. People most of the time give it with a lot of unpleasant feeling. So we should build a business around a model where the patients are not happy. At the same time is an essential. At the same time, it should be giving the affordability for the people to access it. What are that which we can do it? 2050 model will answer these questions. Number one, the technology. Yes, technology part will be extremely capable. Today what we see, equipments, medicines, diagnostic tools, all these things will transformatively changing. Today if you want to do your blood test, you have to give your sample. Sample need to be taken to a lab. A lab will need to be tested. Within 2 hours you will get your report. This will change. You may be able to do it at your home. You don't have to even to go to the hospital. You will have fabrics which will be monitoring your health continuously. The hospitals don't have to spend too much of money on treating them to make them better. Rather than hospital will create an environment of health to ensure that they continue to be healthy. There will be a yearly health checkup, continuous monitoring through their wearables. Wearable is becoming common today itself. 2050 you will have much more better wearables to see that one. Investigation and diagnostics will be very, very different. Medicines will be very different, which will be more personalized. Today, Calpol or medicine for your fever and vomiting is common for everybody. For cancer, chemotherapy medicines is reasonably common for everybody. Tomorrow, each of people will have their own specifically personalized medicines coming, genetically coded and established in such a way that one has got the minimum side effects on that one. So, not only the technology, the healthcare model itself will change. So, healthcare will be a more pleasant experience than a sick care, what is happening today.
So, you've already been through and you've been through a lot of challenges, you've overcome them. I mean, are there still any bottlenecks, that you really want to wipe it off and still in the process of doing it, have kind of achieved something, but then still, you think that can be completely wiped off?
Healthcare definitely has got many areas which needed to be rectified. One of the biggest challenge in the healthcare, everybody complain, is two things. One, the waiting time. Secondly, the transparency of the charges. Yes. Right? These are the two things most patients give us the complaints. So, how do we reduce the waiting time? We can look at it in two separate verticals of the waiting time in the hospital. One is which is attributable to the administrative processes. Yeah. The other one is attributable to the doctor care. Okay. Whichever is connected to the administrative processes, which we will be able to control to a great extent in the near future. The proper workflow management, proper scheduled system, proper monitoring of the process and outcome, the TAT, the turnaround time of different processes, which will help us to improve a lot on reducing the waiting time of the processes. The doctor-related waiting time can also be brought down with a lot of digitalization and leveraging and empowering them with a lot of data, which otherwise takes a lot of time for them to process and then take the right time to take the decision for diagnosis and treatment. Now, if you are able to reduce this waiting time and give them a good predictability for the patient, that will be the most happiest patient, which currently we still lack to a greater extent. Okay. We have improved a lot, with the help of the HIS and Atma and other tools, a lot of workflow management, other things. But at the time, we need a long way to go to ensure that a patient get that kind of satisfaction, that my entire OPD journey to the hospital is going to finish within these 2 hours, and I will be happily coming back, finishing all my requirement of treatment. In the same way, if my admission to an inpatient, I need not to be waiting there for 2 hours, 4 hours for a bed. Instead, all my previous admission formalities and everything, consent has been signed and everything is ready. I know that 4:15 when I reach the hospital, my bed is ready. I have to straight away get into the bed. My all investigations are done. Tomorrow, next day morning, my surgery is posted and I don't waste any time. Communications are good. So the waiting time and predictability are the 2 major factors of the today, what we need to improve on that one. Secondly, the transparency of the billing. Every patient will be always very, very upset if he see a wrong billing happening. Okay, according to the hospital is a wrong billing, but according to the patient, it is cheating. It's a big difference between these 2 understanding. So a strong billing system supported with the intelligence of avoiding any wrong billing is very, very important. 99% of the hospitals today who are controlled by the centralized billing system generally don't do any mistake intentionally, but mistakes can happen. We need to reach to a situation where these kind of mistakes are picked up much early before it reaches to the patient. So that will bring a lot of transparency to the patient, and he also will be happy that, okay, I was told that my surgery and all other treatment will cost me 5 lakh rupees. And when I get discharged, it should be 5 lakh 10,000 rupees or 4 lakh 90,000 rupees. It cannot be 8 lakh rupees, right? If that happens, whatever kind of good work we have done, all through his, all get questioned there. So we are creating an unhappy patient and continuing to another unhappy bunch of people around him. So it's very, very important to have these things addressed very quickly in the healthcare sector.
If you could time travel to the future and see one hospital workflow in action, which one would that be?
The most critical for the hospital workflow is his appointment system, because that is the touch point of the patient to the hospital. We call it as moment of truth. A patient learn a lot about that hospital through websites and from people talking, and he create an image and he come to the hospital and then hit the counter and lobby and start interacting with our system there. That is a moment of truth. If that can be made so pleasant and give him a wow experience, that will be the most critical thing which a hospital designing can bring in. And all other things happens after that experience. You can expect a patient drop out of that one. You can expect a patient continue to be with you for your other services. So create the moment of truth matches with his expectation.
Yeah. So with that, we conclude this episode of Healthcare Off the Clock. I hope you have enjoyed listening to Sir and all the insights that he has brought to you with his wide experience and with his challenges that he has faced across the board. And Sir, I would thank you first of all for sparing time for us.
Thank you very much for listening our podcast. We request you to like and share our podcast to all those who love to hear about healthcare and its future for us in this country.